Welcome back. The tragedy of the pandemic unfolded most clearly at long-term care centres, where Public Health Ontario says there have been more than 45,000 cases since the pandemic began. More than a third of all COVID-related deaths in Ontario have been at these places. We've come to Idlewild Manor in Hamilton to hear from the people who work and live here what the pandemic has been like for them. In the early days of the pandemic inside Idlewild Manor, Kim Mellinson says she was a bit scared she may die from COVID-19, but she's tried to keep a positive attitude.
If it's my time to go, let me go.
She's facing her mortality in another way, battling cancer. Fellow resident 83-year-old Noreen Smith has also tried to stay positive, but during the first lockdowns, when she still lived alone in her old apartment, it was difficult.
It was horrible. We were all in our apartments, and we couldn't even go downstairs in the room.
Those lockdowns were tough on the families of residents, too, who were not allowed to visit, forced to check in on loved ones over the phone or through window visits.
It was a horrible, horrible time for everybody that had loved ones in long-term care.
With vaccines still a while off, families could only hope their elderly relatives didn't get sick. But even with vaccines, as the months dragged on, many did.
There were previous waves, and we were fortunate that Mother did not get it. But this last wave, she did.
So did Mellinson.
I was locked in my room, which I think is great. They gowned up when they came in.
Since the pandemic began, Idlewild Manor, which is a 192-bed nonprofit facility, says it's had 6 outbreaks, less than 60 cases among residents and staff, as well as 2 resident deaths. Those are relatively low numbers compared to some other Hamilton long-term care homes, like for-profit home Grace Villa, where during a single outbreak in 2020-2021, there were 232 resident and staff cases, and 44 of the 156 people who lived there died.
You know, given the circumstances, we're very proud of the way our organization has responded to COVID-19. Do I wish that it was 0 outbreaks and 0 deaths? 100%. But it is what it is, and I think we did the best we possibly could have.
That's a sentiment echoed by Smith, who says she doesn't even think about dying from COVID here, trusting the vaccine, the protocols, and the staff.
I never really worried about it, to tell you the truth, because I see what kind of work they're doing here.
Staff like husband and wife PSW team Jerome and Precious Inez, who have worked extra hours for years now, with Precious herself recently catching the virus.
Most of our co-workers, they are willing to be here. They volunteered the extra hours.
And protocols like testing everyone who comes in.
When you come into Idlewild Manor, you're greeted by a screener who asks you some basic questions about how you're feeling, what your vaccination status is. You're then directed towards a testing room. Everyone who comes in has to be tested to see if they have COVID before they're allowed to enter. This comes down here. There's a number of staff and stalls. You come in, you sit down, you do your swab, and after sitting and the result comes in, they let you know if you're able to come in.
94% of residents have 4 vaccination shots, and over 90% of staff have 3. But with a 7th wave predicted for Hamilton this fall due to waning immunity and the higher chance of transmission during the colder months, there's still work to do to prepare. Like most long-term care homes, Idlewild suffered staffing shortages during the pandemic. Senior Administrator Renee Guder says the levels are now adequate, but they could always use more.
Some days were not easy. I know that many of our staff have had to work, certainly double shifts, maybe even more than that from time to time.
Guder says they're also preparing to incorporate new advancements in COVID treatments, including an IV form of Paxlovid that's in development. As we look forward, the overwhelming loss in long-term care will not soon be forgotten. The Ontario government says that as of June 14th, 4,587 residents have died, along with 11 workers in those homes. One thing we kept hearing from families of long-term care residents was a concern about the pace at which restrictions are being relaxed and a hope that people continue to take precautions to keep the most vulnerable safe. Now, some of the most vulnerable got very sick with the virus and ended up in hospital, places like Joseph Brant here in Burlington, where doctors and nurses worked tirelessly to keep up with the flood of patients.
I came in here in the winter and it's now summer, so I'm looking forward to getting outside. The people at the hospital did a wonderful job, and I'm alive.
It was really hard to breathe, yes. I don't remember anything after. whatever I went through, I wouldn't want anybody else to go through.
These are some of the voices of the survivors, COVID patients who required extensive hospitalization to recover from the virus. Some had to be put on ventilators and monitored in intensive care units, like this one at Joseph Brant Hospital, which has treated COVID patients since the very start of the pandemic.
It was really unlike anything we had ever seen before. The early phases of the pandemic were really characterized by so much fear and uncertainty.
ICU surgeon Dr. Paul Lysecki has worked the whole pandemic at Joe Brant, which, like ICUs across the province, had its resources pushed to the brink. He says the hospital also took on a large number of patients from other regions that were harder hit. He remembers the biggest surge of patients during wave 2 and 3 before vaccination was widespread, and while case numbers were sharply climbing.
We really did reach a point where we were surging out of the physical space of our ICU.
He says the pace of work exploded, and he and his colleagues worked extra hours to keep up, seeing far higher numbers of severely sick patients than the ICU was accustomed to dealing with.
Seemingly countless patients, and more coming in regularly with such severe illness.
We never knew what each day was going to bring. We'd watch across the world and see what happened in New York and Italy.
Erin Jameson played a key role in Joe Brant's early pandemic response, and she continues to help the hospital handle COVID-19 and prepare for future waves.
Well, we're struggling like everyone is with getting staffing our health human resources.
She says lessons learned during previous waves will be applied in the future, like how to function with fewer staff and working with regional partners to get every patient the care they need. The ICU has expanded from 20 beds at the start of the pandemic to 24 now. Currently, it's about 80% full, which is what they want, so there are beds available for a surge of patients.
Can't have them wait while you're trying to get the bed ready.
There are only 2 COVID patients left in the ICU, and Dr. Lysecki says they're seeing more patients with the more usual pre-pandemic medical problems, like heart attacks, but that could always change in the fall.
I think we've all learned not to expect the unexpected when it comes to the pandemic, and I've kind of given up on trying to predict what's going to happen next.
In the meantime, hospitals across Ontario now have to deal with a massive backlog of non-urgent surgeries, including Hamilton's biggest hospital system.
Before the pandemic, Hamilton Health Sciences already had a backlog, and COVID's made it worse. Right now, there's about 1,400 kids and 6,000 adults waiting for surgery. To help work through the backlog, HHS will start doing some procedures normally done in Hamilton right here at the West Lincoln Memorial Hospital in Grimsby.
So for children, we have twice the number of children waiting beyond the recommended wait time.
Leslie Gauthier from HHS says they are seeing long wait times for specific surgeries, things that are not life and death, so weren't prioritized during COVID.
I think it's going to take us a number of years to catch up.
But she believes utilizing West Lincoln Memorial will help. The hospital is also opening a 15th operating room at Hamilton General and trying to recruit more staff.
As COVID cases in our hospitals decline, another crisis continues. Healthcare workers, frustrated, fed up, and burning out. Some switching jobs, others leaving their careers altogether.
There was just so much devastation, right? So much loss, so much pressure, so much, I don't know, I don't have all the words.
Hamilton area nurse Amy Archibald Varley spending the pandemic in emergency medicine, now coming to terms with her next steps.
And seeing how hard it has been on everybody in the system, it's just, I think it's time for me to change.
A recent survey from the Registered Nurses Association of Ontario found the level of burnout has climbed to a staggering 75.3%, as more frontline workers say they are exhausted and disengaged on the job. More than a quarter of nurses reported taking time off to manage stress and anxiety directly caused by the pandemic, sitting at 26.2%. Plus, 69% of nurses say they plan to leave their positions within 5 years.
Once we can decrease the workloads and enable nurses to provide the quality care that they are eager to provide, we will retain them. We will retain them because we sign with Ontarians to take care of them. And I have a feeling that the Premier is signing with us to help us lift nursing out of this crisis. I'm very hopeful.
Some signs of optimism there from the head of the Registered Nurses Association of Ontario, but a major roadblock remains with growing calls to repeal Bill 124, a controversial piece of legislation that limits public sector wage hikes to 1% a year.
Bill 124 is an oppressive piece of legislation that really focuses on predominantly female professions, nursing being one of them.
In fact, the Ontario Nurses Association considers Bill 124 a pay cut, given the rate of inflation. As Doug Ford looks ahead to his second term as Premier, he appears open to discussions, but not making any promises just yet.
We're going to sit down and negotiate fairly with no matter what union it is. But I'm a strong believer of being fair with the people. They're out there working hard, doing a great job, and we rely on them. So I'm very grateful for everyone, especially the nurses.
As for Archibald Varley, she's saying goodbye to the ER.
Although it was bittersweet to leave the emergency department, I still will be working on quality improvement, looking at making care accessible for all Canadians and seeing better healthcare outcomes for all Canadians.
She'll be moving into a new role in health equity.
Speaking of emergency medicine, those departments still feeling the pressure of this pandemic, a situation made clear when breaking down some of the wait times being experienced across the province. That data tracked by Health Quality Ontario. Here's the provincial breakdown for April of this year. On average, all emergency patients waited nearly 2 hours just for their first assessment. Low urgency patients not admitted to hospital spent an average of 3 hours in the ER, with 76% getting out of there within the 4-hour target time. That number climbs to 4.5 hours for high urgency patients who are not admitted, with 90% wrapping up their visit within the target time of 8 hours. But those wait times skyrocket when it comes to the patients who require a stay in the hospital. On average, those patients are waiting 20 hours in the emergency department before being admitted. The target of 8 hours being met only 25% of the time. Those numbers varying by a considerable degree depending on where you're going, and some of the numbers locally are staggering. When it comes to wait times for patients who need to be admitted within the Niagara Health System, take a look at this. At St. Catharines General, the average wait time in the ER climbs to 33.4 hours. In Welland, that number jumps even higher to 45.3 hours. And at the Greater Niagara site in the Falls, those patients are waiting on average, get this, 55.9 hours. That's more than 2 days. We reached out to Niagara Health for an interview. They declined, but sent CHCH News a statement saying they're short-staffed while dealing with a high number of patients. They also point to other factors as contributing to these excessive wait times, such as a lack of access to family doctors and ER patients waiting for spots to open up in home and long-term care.
Still ahead, working from home and making that return to the office. We'll look at the evolution of our jobs and expectations. That's next.